I don't think we have any general announcements. We do, obviously Monday's a holiday for us, so although we still will have some pandemic response activities going on, the office will officially be closed, but that's probably the only thing that I had to add other than our agenda.
Okay. Anybody else have any announcements before we go to the next item? Okay. All right, so next item was review of the December 18th. Feels like a long time ago. It's probably warmer then. Do you have any edits to the meeting minutes from December 18th? If not, I'll entertain a motion to approve.
This is Lynn. I can make a motion to approve that.
Thanks, Lynn.
This is Amy Lavalla. I motion second.
Thanks, Amy. All those in favor say aye.
Aye.
Unmute and say aye.
Aye.
Aye. Aye.
Aye.
Any opposed? All right. Good to go on to the next item then. So Melissa, budget.
Hi, everyone. So I think the revenue and expenses through the end of December, which actually included period 13, got sent out last week. I'll just kind of make some general statements about our year-end numbers. We were down in lots of areas as COVID affected just about every part of our operation. That being said, we recouped the difference with the CARES funding, and what I'm still working on for year end, our revenue budget will go just over 100% for the year. Expenses are mostly in, so I don't see them changing a whole lot from the numbers that are in front of you. And that's pretty much where we will be for the year. So we did receive more CARES funding. The date got extended initially, and then we were awarded another $600,000 for local public health and another $3 million for task force. And so we haven't figured out how that is all going to be spent yet, although I'm sure there'll be no problem spending it, the majority of it anyway. So stay tuned for that, but that's where we sit today. So any questions on either one of the revenue or expenses or the CARES funding, go ahead.
Any questions for Melissa? Okay, Melissa, just one question. The CARES funding, does that come through the state and then the state is distributing it, or do we get it directly?
No, it all flows through the state. It's a federal grant through the state.
Okay.
Yes, it's still part of the CARES funding they received. So.
Okay. So do they have any additional parameters that they placed on it that we have to comply with, or are we?
No, it's no, everything stays the same. It's for all mitigation of COVID in the pandemic. So nothing has changed with that.
Okay. I know there was some discussion, I think last time, about the funding formula, but maybe that was more related to distribution of how many vaccines we've got. So maybe we'll get into that, and I'm getting ahead. That might be good to touch on that, Desi, when we get to that point too. Okay. All right, if there's no questions for Melissa, we can move on to Robin. Hey, Robin. I saw you earlier, Robin. Now your screen is blank though.
Should we, do you want us to jump to COVID if she is having difficulty?
Yeah, let's
Can you hear me?
Oh, go ahead.
Yep.
Okay, so I can't hear a thing, so I just dialed in on my phone. I do have my presentation ready, and I can give it if that works.
That works.
Okay, great. And I just need to share my screen then, right?
Yep, I think so.
I can't hear a thing. Your speakers? Yep. Share my screen. No, it'll take too long to set it up, I think.
I'm like Lori's helping her.
Are we seeing anything yet?
Yeah, we do.
Okay, great. Well, I will go ahead and get started. I apologize for the technical difficulties. So this is drug-related death data for Cass County. We put this together because there have been an alarming number of drug-related death increases in 2020. And so we just wanted to bring this to the public's attention and hopefully be able to find some solutions to this issue. So the data that I'm going to share is from the Cass County Coroner. So I'm going to use the Cass County Coroner data to illustrate the increase in drug-related deaths. I'm going to discuss the trends in the trends in drug-related deaths and demonstrate the increase in opioid overdoses using our syringe services program opioid overdose reversal data, as review increases in our syringe services programs participants, visits, and naloxone doses distributed as possible indicators of increased drug use, and also provide the CDC's recommended actions as a result of the increased overdoses nationwide. So here's a look at our opioid-related deaths going back 2013 through 2020. The 2020 data is not final yet, so those numbers actually could potentially go up. As you see, in 2016, we had our highest number of opioid-related deaths, and many of you probably remember during that time, we had a lot of opioid-related deaths. We had, quite a few in a short amount of time. We saw a lot of young people dying, and then after that, we did implement Naloxone or Narcan community-wide, and we've been doing that ever since. And I think in 2017, we were able to cut that number almost in half, and I really believe that had a lot to do with the accessibility of Naloxone in our community. This is a look at meth-related deaths, and as you can see, 2016, we had about half the amount of meth-related deaths as we did opioid-related deaths, and if we jump ahead to 2020, that has now flipped. We have over twice as many meth-related deaths as we do opioid-related deaths. And one of the reasons I believe this has happened is because we provided a lot of education and information to the public about how deadly opioids were and about all of the risks for overdose. And what we have been seeing, and we've even been told by our syringe services program participants, is that many people chose to no longer use opioids, but switched to meth because the perception for them is that meth is actually safer. And as we can see here, that simply is not the case. And in many ways, meth is less safe because we don't have an opioid antidote for meth like we do for opioids. So there's nothing that we can give someone to reverse a meth overdose. The other issue with meth is the fact that there is no medication-assisted treatment for someone with meth use disorder, whereas there is for opioid use disorder. We have methadone, buprenorphine, naltrexone. All of those are evidence-based medications that help an individual get into recovery from opioid use disorder. And unfortunately, we do not have similar medications for meth. This is a look at all of the drug-related deaths, excluding alcohol. And as you can see in 2020, we did have quite a bit of an increase. We did see an increase in 2019, but then we saw quite a bit of a dramatic jump in 2020. And again, 2016, this number was quite high. 2016 was a pretty bad year for drug-related deaths overall. And this is a look at our alcohol-related deaths. In 2020, we had a big increase again, a large increase from 55 to 72. And if we note also 2016, there was a high amount of deaths as well due to alcohol. Now, alcohol-related deaths are any death where someone died of an injury and their BAC was 0.08 or higher. This would also include someone who died from alcohol poisoning. And this also includes individuals who have had a known history of alcohol use disorder and died as a result of, let's say, cirrhosis of the liver, for example. They would be included in this as well. This is a look at all of the increases that we have experienced from 2019 to 2020. The highest increase was with meth-related deaths. It was a 75% increase. Drugs, and that would include all illicit drugs or prescription drugs that were misused. That was 50%. Alcohol was a 31% increase, and opioids was a 27% increase. We were not alone in seeing increases in 2020. There were increases throughout the nation throughout the 12 months, and they nationally there has been some data that has been collected and released that it's provisional data, and it showed fatal drug overdoses from June 2019 to May 2020. And all of the states there that are in the bright orange or almost a red color, all of those states saw a 20% or greater increase in fatal drug overdoses during that 12-month period. And that actually is the highest amount nationally ever. That was the highest amount of fatal drug overdoses for any 12-month period in the U.S. ever. This is a look at our syringe services program. These are participant-reported saves. A save is when someone uses Narcan or Naloxone to reverse an opioid overdose, and therefore that person then lives. And so we supply a lot of Narcan or Naloxone to our syringe services program participants, and when they come back, we do ask that if they've ever used any, that they report that to us and let us know. And so this is a look at those participant-reported saves using Naloxone or Narcan from our program. And as you can see, that number spiked in June all the way through December of 2020. The lighter color is 2019. The darker color there is 2020. And I should note that Narcan and Naloxone are terms that are often used interchangeably. Naloxone is the drug that reverses opioid overdose. Narcan is a brand name for the nasal spray formulation of the drug Naloxone. This is a look at Narcan Distribution or Naloxone. We do offer two types of Naloxone at the Syringe Services Program. We do offer the nasal Narcan, and we also have intramuscular injectable Naloxone. And a lot of our participants are comfortable using, after a brief training, they're very comfortable using the injectable Naloxone, and there's a huge price difference. One dose of the injectable Naloxone is $7.60. One dose of the name brand Narcan nasal spray is $37.50. So the more doses of injectable we give out, the more we can buy. So this is just a look at how many doses we distributed. And again, we have the 2019 numbers by month compared to the 2020 numbers. And again, we definitely saw an increase in April of this year, and it pretty much, and then we had some peaks in in June at 506, and then again in December at 428. And we did set a record in January, just this past month. We distributed 588 doses of Narcan to our syringe services program participants. And so we really feel that the number of Narcan doses and saves that we are recording is really mirroring this increase in overdoses that we're seeing in our police data as well as our coroner death data. This is a look at the number of visits by month to our syringe services program. We, again, have compared 2019 in the lighter color with 2020 in the darker color. And if you take a look at March there, we really saw a very large increase in the number of visits, and that was in March of 2020. And that really was sustained all the way through the end of the year. And then last month, we had 428 visits in January. So that is, we're continuing to see record high numbers of visits each month at our syringe services program. But I did point out that to our commission that this actually is a good sign, that, the fact that people are willing to come to us and to receive services and to receive supplies, and that we can help them get on a more healthy path, one where there is less risk, and hopefully eventually one that leads them to treatment and recovery. So the fact that we're seeing this many people is a good thing. If people are not engaging in services, they cannot get better, they cannot improve in their health. And so we're happy that they're engaging in services. Many other services during COVID were shut down. And so, but we did remain open. There was not one single day that we closed our services to our syringe services program participants during COVID. So we were there for them throughout the entire time. And obviously they placed their trust in us and have continued to come see us in record numbers. So just to put all of those increases for our syringe services program into perspective here, we had a 51.6% increase in the number of visits from 2019 to 2020. We had a 42% increase in unique participants served from the second half of 2019 to the second half of 2020. We had a 39% increase in the number of Naloxone doses distributed from 2019 to 2020. And we had 155 self-reported opioid overdose reversals in the last half of the year, July 2020 through December 2020, when we only had 200 in the entire year of 2019. So you can see we definitely have had an increased demand for services. So in response to the alarming increase in the amount of overdoses and overdose deaths from drugs, the CDC did put out recommendations for public health departments. A lot of it was increasing or raising awareness, especially about the need for bystanders to have and to use naloxone, to increase the awareness about the changing illicit drug marketplace, about the co-use of fentanyl with other drugs such as meth, and about the mixing of fentanyl into other drug supplies, and also increasing the awareness about the risk of using drugs alone and emphasize harm reduction strategies for people who use drugs, including during the pandemic. And the strategies that they recommend included not using drugs alone or knowing what drugs are being used, ensuring that naloxone is available and that people who use drugs and their loved ones know how to administer it, and to have a friend or loved one check on people who use drugs, especially during use. It also recommended that we provide messaging to community groups, particularly those that serve high-risk populations, as well as all of the leaders in the community, that they understand more about the changing illicit drug supply and risks for overdose and exposure to highly potent opioids. And you may have seen in the news that the Fargo Police Department has seized 600 fake, or I should say manufactured, counterfeit actually, opioids that were extremely, extremely potent. And those, I believe, they were trying to pass as oxycodone. And also, it recommends that we link those at risk with care and that we track their retention in care, and that we consider expanding our peer navigation programs or peer recovery coaching to intervene with high-risk individuals. And this all came out of the CDC's Health Alert Network number 438. There is a link there if you want to read the entire document. It's quite lengthy. Luckily for us, we are already doing a lot of this work with the highest risk group of all, those who inject drugs. That's who we serve at our syringe services program, and we are actively doing all of the things here that are suggested. So in summary, I just wanted to recap that all categories of drug-related deaths did increase in Cass County in 2020, and it was primarily a trend throughout our nation. Opioid and drug-related deaths also increased in 2019. Meth-related deaths increased in 2018 and 2019. And in 2016, opioid deaths were nearly double that of meth-related deaths. However, in 2020, the opposite was true. Alcohol causes more deaths than all other drugs combined. And that Fargo-Cass Public Health Syringe Services Program has experienced significant increases from 2019 to 2020. And that in response to national increases in drug-related deaths, the CDC issued recommended actions for health departments, healthcare providers, first responders, and public safety departments. So I will stop sharing my screen, and if anyone has any questions, I'd be happy to answer them.
Any questions for Robin?
I have a question. This is Tracy. On your previous slides, when you were depicting the increased rates of drug-related deaths, and I guess all increased rates, do you know an age breakdown in particular? I'm just wondering if there's an increase in adolescents in our community doing these things.
So the coroner does have everyone's age. And I have seen that data, and I can tell you that we are not seeing adolescent deaths from drug overdoses. And if I were to just kind of guesstimate what that age range is, it's primarily 25 to 45.
I apologize, I was briefly disconnected. So were you saying you don't have exact numbers, but that's the highest nationwide?
No, so the Cass County coroner does have the age of every person that did die from a drug-related overdose in our community. I don't have that at my fingertips right now, but that is certainly something that we could get. I have seen the ages before, and what I can tell you is we very seldom have adolescents that are dying from drug overdoses, those that are under the age of 18. And if I were to just take a guess at what the age range is, it's typically between 25 and 45 years old.
So, Madam Chair, this is Adela. I'm sorry, it seems to be echoing. Is that my problem?
I'm wondering if it's because I have my phone and my computer going at the same time. I'm going to step further away from my computer. Is that helping?
Okay, there we go.
Either your computer or your phone.
Okay, so we had a pretty good discussion, I think, at the City Commission level about this data. And there's going to be a meeting, hopefully next week, with some of the mental health CD providers in town. It would be really helpful, I think, to get some feedback from this group in regards to, and you know, the only thing we have really in front of us right now are those CDC requirements, or I'm sorry, recommendations, and whether there's something that we should be looking at community-wide in trying to follow through on some of those recommendations.
That meeting hasn't been set yet. Is that what you indicated?
I'm sorry, I didn't hear that last comment. It kind of broke up.
Oh, sorry about that. So you mentioned there's a potential meeting next week with some stakeholders to talk about this data? Okay.
Yeah. Share House is organizing that. So I don't know exactly who it's Ty Hagland is kind of organizing the meeting. And I don't know how far out he's reaching or who would be included, but I'm thinking there might be some insight that comes through that meeting as well.
Yeah. Robin, are you by chance connected with Ty?
Yes, I am.
Okay. Good. I'm sure well, if he's not aware of this data, I think it's certainly information to bring forward. And I appreciate Dr. Newman's question on the age bands too. It's good information to have. It sounds like there's a connection at least. Would you, well, I can, just trying to think, are you wondering if other folks join that meeting maybe potentially? If it's like a community meeting or not sure what the overall scope is?
Yeah, I'm not real certain either because it's not being organized by us, but Ty would be the one probably to work with. I guess what I'm looking for, Chelsea, is, and this might be a longer term kind of thing, that the Board of Health becomes part of that conversation in regards to policies or initiatives or whatever the city might embark on, and whether indeed, there's a role for the city to play in the entire provider community, those kinds of questions. And that's not something that probably can be answered today, or perhaps people aren't ready to participate in that conversation right now. But on an ongoing basis, it seems like that would be a really good role for the Board of Health. Personally, for me, I think the commission needs to look to the Board of Health for some expertise and advice on those kinds of questions.
Arlette, I don't know if you have seen the chat, but Dr. Nelson is noting in here that she's treating a lot of clients from Share House, and she uses Suboxone in her clinic. So she does a lot of substance abuse treatments. I, in my practice, don't do quite as much because we don't do the Suboxone piece. So I do mental health in general. But I think Dr. Nelson would be a really great addition to those discussions.
Yeah, no, that's a great idea. If she's willing to join that discussion, I'm certainly willing to join the discussion. I think it's, I'm all for working through initiatives that, whether it leads to policy or community-wide initiatives, I think that is very much a role that we can play. So I'll reach out to Ty and ask about that group.
And I can also indicate to him, I asked him to include some of the public health staff. So by all means, we can add your name to that too.
Awesome. Thanks for bringing that up. Other questions for Robin or a discussion on the information that she brought forward? Okay. Robin, very much appreciate bringing forward the data. I think it tells a compelling story about what's going on in our community, and the next step is to figure out how do we want to address it. But without the data, we wouldn't necessarily know what's going on. So appreciate that insight and the ability to slice and dice it too, so we can get more specifics on intervention. So very much appreciate you bringing that forward.
Thank you.
Okay. All right. COVID-19. I think, Suzanne, are you up first? Talk about vaccine distribution.
Absolutely. Thank you. So I have just a kind of a brief update on what we've been doing in the COVID vaccine realm of our pandemic response. We are primarily in our first 2 tiers of that phase 1B, which includes the 75 plus and the 65 to 74 with 2 medical conditions. I will add that we also at times, just because of the sheer volume of people that we are inviting, do have to kind of step down through those tiers that are in that phase 1B and invite others that are 65 that aren't with the 2 medical conditions in order to fill all of the appointments that we have moving 4 weeks. And so we do that as we continue to call out those individuals that don't have the ability to register themselves over email. We are also working with our congregate living settings, and that is the next phase that is coming up, or part of the next tier of this phase that's coming up, which includes correctional facilities, homeless shelters, group homes, treatment centers. Those are all part of that congregate living piece. And we're working with some partners in the community to assure that we can get the vaccine to those individuals as efficiently as possible. We continue to encourage people to use that phase 1B contact form. There's been some media that is talking about other areas maybe introducing the ability for all 65 plus to get on that wait list. And we have been encouraging all phase 1B since the creation of this form to get on that list. So we have that as our fingertips with the planning tool as well to kind of know where we're headed next. We are still continuing to get new submissions daily, which is great. So we know that form has been utilized and is being utilized by many. We are also getting lots of phone calls in for those people who don't have access to the technology, and we continue to assist them in getting registered. We are planning for about 4,000 doses being administered next week. And there was a press release earlier this week that talked about that 10,000 dose milestone that we should be seeing very early next week. And then the other thing yes, it's a really great accomplishment. And the other thing that we put out a press release, or Holly worked on to get out today, was in regards to when people are entering their information in that phase 1B contact form, just to really be watching their emails so we can get them registered as quickly as possible. And just the importance again of not sharing that link. We know that has happened. Grand Forks had a story about that a while back. So we're doing our best to make sure that we're staying within those priority groups. That's kind of the nitty gritty of COVID right now. COVID vaccine, I should say, right now.
Do you have any questions on the vaccine piece? It's great.
I have questions today, sorry. With my school board hat on, obviously we get asked frequently about teachers. It's my understanding they're the last group in this 1B tier. Is that still correct? And is there any idea of a timeline of when we'll be opening them up for teachers, K through 12?
Yes. So yes, you're correct. They are the last tier of the phase 1B. I do not have a timeline. We're a little reluctant to commit to any time for sure because we don't know that. But I will assure you that we have worked with the school administration, and we do have a plan in order to get invites out once we start getting those allocations. Just not sure when that's going to be quite yet.
Suzanne, when do daycare providers fall into those categories?
That actually is right before the K-12 group.
And just to give the group an idea, I think it was early last week, the state had put out numbers for us again to update us. I think at that time we had done about 42% of the 75 plus group, and about, I think it was 15.5% of the 65 to 74-year-olds with the chronic medical. So, theoretically we have a little ways to go for, those priority groups. So it is hard to judge, and it's hard to judge when you have 69 providers within Cass County that are distributing vaccine. And so that's the other piece. We have people that are maybe they're on our list, but they're on Stanford's list, or they're on Essentia's list. And so maybe by the time you get to them, they've already gotten a vaccine somewhere else. And so it's kind of just weeding through all of those logistics. So I guess we just ask for patience. As we are doing a really, really good job. The team is excellent at getting the shots out when we get them in. And so that's been kind of a constant for us. It's just really hard to judge what that's going to look like in the weeks to come.
So Desi, can you tell me a little bit more, that older age group with medical conditions? I'm assuming most of them are perhaps going through the providers. I guess my question is related to, are the providers at a different phase than perhaps public health?
Well, they theoretically could be. I know other counties around us are getting through their priority groups faster because they have less population. But I think what we were hearing earlier on was that public health was actually getting to people faster than the health systems were. I don't know if that has switched around yet or not, but that was kind of the case early on. But, you know, it's helpful now. We have a federal allocation that's coming to Thrifty White, you know, that's outside of the state allocation. They've talked about a federal allocation coming to the FQHCs. So family health care at some point over the next weeks will start getting an allocation direct from the feds. So all of those extra allocations are above and beyond our state allocation. So it will all be helpful for our area to get more vaccine.
Jesse, would you recommend that folks get on, you know, maybe multiple lists? I don't know how that works. So if they can't to get it from public health, but they're also on the list for Sanford or Essentia or whatever?
We have put that out several times. The backside of that, if they do that and they do get their vaccine somewhere else, it would be helpful to know that they've gotten that. So whether then they reach out to public health and let somebody know that they've received that vaccine so that they no longer need to be on our list, that kind of helps, you know, us to do a little detective work on the backside.
Gotcha. Excellent. I saw earlier this week that Uber is partnering with Walgreens to get folks with transportation limitations to their vaccines. Of course, they're targeting the Chicagos and the big, you know, metropolitan areas. Any issues that we've seen with transportation being able to get folks to get these vaccines, or any thoughts around that? It's cold out there.
I can tell you kind of what I've been hearing in regards to that from this end is, you know, we do have people that will maybe ride with a friend or somebody else who fits in that same age group or priority group to get the vaccine together. We also are making referrals to the senior ride program, and they are working with people, I think, to ensure that there are rides available.
Okay.
And when we have the congregate living groups that start on the 1st, there are some of those agencies that are willing to, you know, transport and bring them to our static site. And then some of those will be more of a mobile mission if there isn't availability to do that.
Okay.
Any other questions on the vaccine part? I will just, I was just going to give you the general, although it feels like we're only doing vaccine, we're not. We still have our other activities that are ongoing. So we continue with our contact tracing group has been downsized a little bit just because of numbers in CAS and across the state going down. And then we have also kind of shifted some of those folks to help with other missions. So a lot are helping with that community list that Suzanne refers to, help calling people, getting them registered. Some are helping at the vaccine clinics. So that has been good to have that flexibility in staffing. We are still doing, obviously, the testing at our static site as well. So we are doing logistics for the testing and doing logistics, you know, for the vaccine clinics too is a big role for us. We continue to support, you know, giving guidance and education to school settings, to local businesses on their, you know, any restart changes. That's still happening quite often. Our general messaging, of course, Holly is busy with that on any given day because those needs kind of continue to change as well. we still have our Q&I center that the harm reduction staff is managing that. Again, that's at the old Fargo PD site. So, and actually we have the Gladys Ray shelter is obviously housed in that building right now too, due to some mold issues in our normal buildings. So lots of stuff that's still going on. So I know that as far as the community is getting pretty comfortable with our numbers being lower, and we're starting to get those questions about, you know, the mask mandate and people not wanting mask mandate anymore and all of that stuff. And of course, you know, we are far from done in our pandemic response. We are far from done wanting people to wear masks and doing all of those mitigation strategies. So I know our city mandate is set to expire on the 18th of February. I'm guessing since at the last commission meeting, it was a motion was made to drop it at that time, and that did get defeated 3-2, but I'm sure we'll get brought up again next week. So I guess that would be the ask from us as public health, and we would like from you guys as the board. It's like, you know, if that mandate does go away, it still has to be really strong messages that, you know, masks are still going to be needed. We're hopeful they would do mask requirements in all city buildings. I think it would be, you know, a good message to encourage local businesses to continue their internal policies on masking and to support them in that. I know there was a comment made at the commission meeting that kind of implied that the only reason businesses are doing the masking is because of the mandate. And, you know, clearly many businesses were doing masking prior to the mandate. So it is within their right to have that requirement for their private businesses. So that would be, if you get questions on that, that would just be our wish, is that we, you know, we've come a long way in this. We're doing well with numbers, things look encouraging, but we haven't gotten enough vaccine out to the point where we would be comfortable having all of that just go away. So that's where we're at with that. And then Arlette had also requested, we did a brief survey with the bars and restaurants in Fargo. So I was gonna just have Holly brief the group on that, just as far as the results of that survey.
Sure, thanks, Desi. So I double checked with our environmental health team this morning, and we actually sent the survey to any licensed food establishment in the city of Fargo. So it would be bars and restaurants, but it would, it included places like coffee shops as well. So that was sent out to around a little over 300 recipients. We had total 102 responses, and we were able to just capture some information about support for continuing the local masking requirement. So there was just under 75% support total for continuation of the local mask requirement. And we did separate that into some different time categories. So we asked if there would be support for continuing the local requirement for 1 month, for 2 months, 3 months, and 4. And so again, adding all of those categories together, just under 75% total support for continuing it for any of those offered timeframes.
Excellent. Thanks, Holly. Great idea, Arlette.
Yeah, if I could just chime in a little bit. So to give you a little bit of context in regards to this whole issue, as Desi mentioned, it has actually come up in the last 2 meetings to immediately drop the mask mandate, and it was declined 3-2 on both cases. I think, and this is conjecture on my part, but I'm assuming what the mayor probably will do is not bring it back to the commission again. The date that it will actually expire is between now and our next meeting. So it's quite possible that that he will just let it drop. You know, I have some real mixed feelings about this, in that we aren't very far into any kind of herd immunity. I mean, even if we could get up to 50%, that would be wonderful. But the piece that I found interesting, and where I think the city has provided a role in its mandate, is the feedback from the businesses that Desi was reporting on. There are a large number of them that are still supportive of continuing the mandate. Now, the other side of that data also showed that you're starting to see, I think, more, and I apologize, I didn't go back and look at the previous survey, but it looked to me like they're starting to have some issues with staff having to deal with customers that aren't following the rules. So people are getting tired of the mask mandate. That is for sure. But again, this might be a policy issue that it would have been, I think, real helpful to hear an opinion from the Board of Health.
Mm-hmm. So Arlette, do you think, so the next commission meeting isn't this coming Monday, it's the following Monday, I'm taking it?
Right, that's right.
Okay.
And to clarify, Arlette, you don't think that it will be an agenda item again, that it will expire?
I'm assuming so. Desi, I don't know if you've got any additional insight there, but I am thinking the mayor has tended to, in the past, try to do this on his own at times. So I'm assuming that's maybe what will happen here.
Yeah, he did make mention of that, you know, when they were bringing up the motion, and he said, well, it's going to lapse on the 18th. So I assume that that meant it's going to lapse on the 18th.
Are there
Arlette, I'll just make a plea to, you know, it's not just local businesses, it's our public schools. We really believe strongly that schools should be the last places to close and the first to open. So if these kind of mandates lapse and we see county rates go up, that affects our ability to keep children in school. So I think that's a really big arguing point as well, because we're going to still be requiring all of our children to wear masks in schools, and they do it without issue. So.
And to Tracy's point, I think, you know, what's the data, right? We implemented our mask mandate in November, and then we went through all of these holidays, and we continued to see a decline, which might not be related to masks, but I have to say that there has to be a correlation there. And is there what data can we rely on from the CDC or whomever to say, once you see vaccination rates in your county reach this certain percentage, then you can start rolling back mask mandates? I'd like to see us keep with it until the end of school, unless we reach some sort of vaccination goal before then. But to Tracy's point, like, we expect this of our kids and they're doing it, and I want my kids to be able to continue going to school 5 days a week. So do we need to make another motion to recommend that we extend the mask mandate? What are your thoughts, Arlette?
Yeah, I think a letter to the mayor probably would be the most appropriate way to do that, and expressing an opinion, concerns about the mandate going away and the recommendation. Yeah, I think that would be great.
I'm certainly
also, I'm sorry,
ahead.
and then see it to the entire commission would be good.
Yep, exactly.
And it may be helpful to mention that the schools rely on the city, businesses rely on the city, you know, for that kind of oversight to help them enforce it.
I'm happy to make a motion that the board writes a letter in support of extending the mask mandate beyond its expiration date, with some supporting evidence sent to the mayor and copied to the city commission.
Second.
All right, I think we'll need to do a roll call on this one. So Lori, can you help out with that? I think that's how we normally do that. Do a
Okay.
roll call.
Tracy Newman,
Yes.
Evelyn Telford,
Yes.
Arlette Preston,
Yes.
Chelsea Matter,
Yes.
Amy Lavella, Kayla Nelson,
Yes.
Dwayne Breitling.
Yes.
And we do not have Bernie Dardis with us.
All right, excellent. Thank you, Lori. I will certainly take a stab at drafting that, and I'll send it around to all of you for additional edits. But I appreciate you bringing that up and bringing it to our attention that it is set to expire before the next meeting, and agree with all the comments that have been made so far. And let's try and push to see that doesn't happen. For all the reasons that have already been said. So excellent.
And Kelsey, we do have a graph from our dashboard where we have the date marked of the mask mandate that then shows the decline in the cases that could then be included if you wanted with your
perfect
information.
I love it. I like data. All right. Thank you, Tessie. Any other discussion on the COVID front? I know we're going to get to legislative issues, which there's quite a few COVID things that came up this session that have quickly also gone away as well. But any other discussion before we let Justin jump into legislative session? Hey, Justin.
Okay. Well, I said Lori was nice enough to send out yesterday our big full tracking list. So we have 83 total health-related bills that we've been watching. And then the Word document was really just the one that we really have either support or oppose. Of those, yes, a lot of bills have been surprisingly, disappointingly anti-public health coming out of a pandemic, which was a little surprising. We were all kind of perplexed at a few, but luckily, fortunately, a bunch of them have been shot down. So there have been a total of 11 that we support. 6 are still in, and there are 18 that we've opposed, and there are still 6 going there. One of the more concerning ones that's grabbed a lot more attention is a cigar bar bill. It's Bill 1152. That's actually gotten more traction than we all kind of expected. It came out of committee with no recommendation, but it was a tie the first time for a pass, do not pass vote. So a couple others. There have been changes from yesterday. I tried to wait until Thursday to get it sent out to you all so you could get a chance to see the most current. Bill 1403, which was an increased tax on cigarettes, that one was defeated yesterday, 2566 out of the House. And 1422, which was another increase in tobacco tax for the Community Health Trust Fund, which was also shot down, 3358 vote. Those are the only 2 real big updates that I had from yesterday. Other than that, yeah, it's been interesting to see some of the legislation that's come through. The opposing seatbelt laws, one was to drop them for people over 18, and one is to make it a primary. So there's been a couple of those bills as well that battle each other. So is there any specific bills that you've seen, if you've had a chance to look through? I've tried to put any time that they came out of committee for the votes, I try to put that on there as well. So.
Any questions for Justin? It's really been slick this year, everything being online. The downside is everybody can go back and watch you deliver testimony over and over again. But it's pretty slick. So if there are issues that you want to follow, it's nice to be able to go back and look at the videos if you missed it during the time it was being delivered. And so it's been interesting to watch this session. So, okay. All right. Justin got off the hook real easy on this one.
Yeah, that was way easier than I expected. Thank you, guys.
Okay. Anything else? need to discuss in the last 5 minutes that we have together today?
I just want to check in with Desi and see how the staff is doing. I know it was crazy. Is it getting better?
No, it's still crazy. It's kind of evolved a little bit. You know, there's probably pockets of people that are working more now that weren't necessarily working as much previously. There's obviously the core group of management and those in our department operations that have had continuous, some since last January. But I think now that we're getting into the vaccine, at least it's more of a feel good thing, because it feels like we're making progress towards someday maybe not having to do this. And so, and the people that have been coming to the vaccine clinics are so appreciative, and it's a much different vibe than, you know, early on when we were doing all the testing and that mission. So I think people get tired, people get stressed, but we're trying to watch out for each other and encourage people to, you know, help delegate or to, you know, try to get some time away from the office. But overall, they're doing a fantastic job. And I think we have gotten a lot of feedback from the community on our response and the efficiency of our response and what a slick process it was. And so from that standpoint, I think, you know, whereas early on in the testing, and we used to get more of the, you know, people not liking what we were doing, I think now it's kind of, you know, the process is just working so well. I think the site location works well, and you know, I guess I couldn't ask for a better team. So for that, I'm really proud of them.
Well, we appreciate everything that you guys have done and continue to do, and just remember to take care of yourselves as well throughout this. But you're right. I think we're looking at some sunshine in all of this now with the vaccine. So keep it up.
Appreciate that.
Excellent. Thanks, Lynn. Any other items? Otherwise, I have a very compelling letter to write. And I will do that and get that to all of you. Okay.
Chelsea, do you would it be helpful to have the mask survey results as well, just from a business support? Holly, maybe you could send that to Chelsea.
Yep. I'll take any data you want.
I actually have 2 studies that I can send you as well, Chelsea. That'll be good.
Okay, awesome. Perfect. Okay. So the next meeting is set for April 16th. We've talked before about meeting monthly. Are we? Is everybody feeling okay with that being the next meeting date? Do we feel like we need to touch base briefly in March at all? You okay? Okay. All right, let's stick with April. And if something comes up, please let us know, Desi. Otherwise, I'll be in touch with you all here shortly. Okay. Happy Friday.